Tim Bensman, student pharmacist, level 3.
Matt Din, student pharmacist, level 3, USC School of Pharmacy.
Big John, USC School of Pharmacy, level 3.
Jonathan Hong, concerned consumer.
The whole reason I got into pharmacy school was my dad was diagnosed with cancer about 10 years ago, and he was having surgery, he had bladder cancer, and the doctor was talking about treatment regimens after the surgery, like, you know, what types of medications and stuff are going to be on board, and how they're going to be, how it's going to affect him, how they're going to do this, how they're going to do that. And my mom and I were sitting in the hospital, and the doctor, like, we had questions, and the doctor couldn't answer the questions. So we were kind of like, you know, shouldn't you kind of have a better idea of? And he was just kind of like, well, you know, it's not the same for everybody, this, that, and the other. And I was like, okay, you know, I took that. But then I said, I went down and tracked down the pharmacist at the hospital my dad was staying in, and I talked to him it was a busy day. Talked to him for about 45 minutes to an hour, sat there, and I said, look, I have questions about these medications. You know, treatment plans for chemo, and the pharmacist was like, you know, I don't have all the answers, but what I know, I'll tell you, and if I don't know something, I'm going to tell you I don't know. And he took the time to sit there and talk to me and explain that, you know, this is what's going on. And as soon as I hit something he didn't know, he's like, oh, you know what, I don't really know too much about that one. But I left there with a really good feeling. I was like comforted necessarily, you know, I was like comforted, like, oh, you know, it could probably be okay, or it's not going to be okay. Not just saying that, but just that I had some more information that I could hold on to, and kind of gave me like a, hey. And I was telling my grandma that story like 2.5 years later, and she's like, hey, why don't you, that sounds like something you could do. So I got online, and I was like, pharmacist, because I never thought about being a pharmacist, you know. It's like doctor, lawyer, you know, trash man, that stuff, but you don't think pharmacist when you're growing up. So I got online, checked it out, and I was like, it sounds like something I could do. And I went back, got the prerequisites, and applied. And it wasn't an easy road necessarily, but I'm here now. So.
What just happened with my grandma was that when I went back, she was hallucinating, and found out that, well, more than likely it was due to an anticholinergic for her incontinence. As soon as she had hallucinations, they called the doctor and said, you know, could it be her pain medications? Yeah, I think there's been one incidence of tramadol, you know, eliciting hallucinations, but it's not the most likely. It's clearly anticholinergics, and us having the expertise in drugs should be able, you know, that's what we provide. That's the service that we provide these patients. What is our role in it? It's management of these patients and their therapy. It's not diagnosing these patients, but the actual management of their drugs and their drug regimens. Because so many drugs interact with each other, it's important for an expert to take care of those people.
Right.
I had an experience just last week where I was given an Asian patient who didn't think I spoke her language, but I just surprised her, and I found out she was totally non-compliant with anything she's been given for her cough, like the last 5 or 4 weeks. She's getting like all these different drugs, even antivirals to one point, and she didn't even take them. But like, I don't know the diagnosis or whatever. I don't know why the doctor gave what he gave, but the point is all her meds were full because she told me that she was scared of the name and she didn't want to take it. But she had no pharmacist telling her that this is something that's very necessary for you to take in order for you to get better. There's times when I just want to interrupt people and ask them why they're looking at that. It's a bit rude and a little intrusive, but it makes a huge difference.
I would kind of like to just get all the pills delivered to my house instead of having to wait in line at the pharmacist. Because that's cool, but like, what you're saying is, you know, like there is a lot more that can be done that I think most people just don't realize.
The community pharmacist is very important just because that they're able to intervene with patients and prevent these problems from even getting any worse than they could be, you know. And that's something that should be recognized for, you know, the future, just because it will not only improve it in the treatment process, but in managing, but in prevention too.
We have to have personal health records, electronic personal health records. We have to have values.
I tell you, when
all
I
that health
volunteered at the
information
VA,
technologies. You have to have
whatever. You're going to make less money if you do it now because you're not getting reimbursed for it. But if you were being reimbursed for it, you can have a pharmacist or 2 pharmacists, because depending upon how much you're billing is how many pharmacists you can have to take care of that aspect of the business. If you're not getting paid for it, the pharmacist doesn't necessarily have the time to do that. He just has the time to fill the prescriptions.
Right.
And do all the administrative stuff, but he doesn't necessarily have the time to go and talk to the customer. But if you're going to pay somebody to do that, then you can hire more people, and then you have that person that can sit there and answer any of the questions that the people have. And I think that we would be surprised by the fact that how many people would come and take advantage of a situation like that, because
I like to think
knowledge is power.